Hello! Your surgeon has prepared this 2-minute video to help you understand your upcoming wide local excision to treat a basal cell skin cancer. This video will touch upon several common questions and concerns and will serve as a foundation for further discussion with your surgeon. To begin, let's talk about basal cell cancer. This type of skin cancer grows irregularly and unpredictably, both within the skin and, if left untreated, into surrounding tissue, like muscles and nerves. The true size and shape of the spot can only be estimated by the naked eye. In order to maximize the chance of complete removal of the cancer, your surgeon will perform a wide local excision. So what is a wide local excision? In the case of basal cell cancer, a wide local excision is the surgical removal of the visibly affected tissue, plus approximately a 1/8 inch margin of normal appearing skin. By removing this small amount of normal appearing skin adjacent to the cancer, the odds of complete removal increase dramatically. After the piece of skin is removed, your surgeon might use stitches to bring the edges of the wound together. In most cases, such a repair reduces healing time and scarring. As part of this process, the wound will be extended into an elliptical or football shape if there is sufficient space to do so. This lengthens the scar but allows for an improved cosmetic result and reduces the risk of stitches breaking due to tension. In some areas, such as the face, a more complex repair technique may be used at the discretion of your surgeon. Following your wide local excision, the removed tissue will be sent to a pathologist to check for the complete removal of the cancer. If it has not been fully removed, your surgeon will discuss further treatment options with you. A wide local excision always leaves a scar, and your surgeon will minimize its appearance to the best of his or her ability. To further minimize scarring and reduce the risk of the stitches breaking, you'll want to limit movement of the affected area for a couple of weeks until the wound is fully healed. Common risks associated with a wide local excision are bleeding and infection. Bleeding occurs less than 1% of the time, and this is made more likely if you are on blood thinners for other medical conditions. If you are taking blood thinners, please discuss with your surgeon at least 2 weeks prior to your procedure to see if these medications can be stopped temporarily. Infection is estimated to occur in just 1 to 3% of cases, and the risk is significantly affected by where on the body the surgery takes place. For example, the legs have a higher risk of infection than the upper body. A local infection can cause redness, tenderness, and pain immediately around the area. Significant infections can happen, so please contact your surgeon with any concerns that may arise. Your surgeon will supply you with specific instructions following your procedure. Please do not hesitate to call the numbers listed with any questions or concerns. After reviewing your case, your surgeon has recommended a wide local excision amongst several treatment options. To learn more about these options, please select from the list below. Surveillance. This approach defers definitive treatment in favor of simply watching the area. The main advantage of this is that there is no surgery required at the time. The main disadvantage is that it gives any residual skin cancer time to grow. In the event that treatment is eventually required, it may be more extensive, require more tissue to be treated, including potentially cartilage, nerve, and muscle, and pose a potentially increased risk of side effects and scarring. Electrodesiccation and curettage, or EDNC. This is a destructive technique that aims to physically destroy any remaining skin cancer. An EDNC always involves the destruction of some normal skin in the process, and it does not allow for confirmation by a pathologist. The success rate is overall lower than that of a wide local excision, and its success varies based on the subtype of basal cell carcinoma. Mohs. This technique checks 100% of the margin the same day of surgery and offers the highest rate of complete removal. It is typically utilized in areas with minimal extra skin around the lesion, such as the nose, ear, and eyelid. Specific criteria are utilized to assess for the appropriateness of Mohs surgery, for which your skin cancer may or may not qualify. It consolidates a typically multi-day process into one single day, but it can be an all-day procedure with significant waiting time. Thanks for your time, and we hope you have a better sense of your upcoming wide local excision. If you still have any questions or concerns, please discuss them with your surgeon prior to the procedure. From everyone here at our practice, we hope you have a great day.